everyone. I've been having joint pain in this part of my hand and my other hand for a couple of years, and I finally went to the doctor to have it diagnosed. There's a clinic near me that has a whole bunch of orthopedic surgeons. I've seen this guy before. He's the hand and arm guy. Had a simple x-ray and we know exactly what it is. So until then, I was consulting with Dr. Google and going online and doing all kinds of exercises, and it turns out with what I have, I should not be doing exercises. So what I have right here is an arthritic condition. This joint is called the basal joint. Sometimes it's called the CMC joint, and I have arthritis right there and right there. I don't have arthritis anywhere else in any joint of my body, but a simple x-ray showed it. So they can do injections there, but I think it would just make it feel better and then I'd be moving it, and the whole idea is not to move it anyway. So I'm going to go ahead and have the surgery. They've been doing this kind of surgery on this joint for many, many years, like 80 years, maybe longer. And it's very successful. I met a woman a few weeks ago who has had this surgery before. She had it 10 years ago. And it's a permanent fix. She said, whatever you do, get it done while you're younger. Don't wait till you're older to have it. You're going to heal better. So I just want to show you a couple things and tell you what I know right now, because my surgery is scheduled for about 3 weeks from now. So I'm doing stuff in my home and getting ready. Well, so like I said, not supposed to exercise it, not supposed to keep it still as much as possible. So the doctor wanted to sell me one of these for each hand, and it keeps it stable. Luckily, I work for a company that sells these, so I got it for a lot cheaper. So it opens up with Velcro, and you put your thumb in it, then you wrap this part around. And luckily, at the doctor's office, I was able to try on a couple different pairs, because then I knew what size I needed. So I have small hands, and this is the size called small plus. But most women's hands are going to be either a medium or a medium plus. And then this goes around here, and it just helps to keep it stable. It can get a little warm. It's called Comfort Cool, but it doesn't really keep your hand all that cool. Probably this is made out of a fabric that keeps it cooler than whatever they used to make them out of. But anyway, so it keeps it still if I need to. You can also wear these while you're sleeping, just to make sure that you're not lying on it or doing something weird when you're totally asleep. All right, so what is basal joint arthritis? Well, I have a drawing. If I can, I'll get my x-rays. That would be nice to show you. But maybe you can see in this picture, it's over here, just in that one joint. And my x-rays, especially of my left hand, show that there's basically nothing left, where my other joints are perfectly fine. And there's a little bit of bony growth in there too. So here's how they fix it. They take a tendon from the arm and then they fold it and they pop it into this spot after cleaning it up. And then they stitch you up, and I think they go in this way. Stitch you up, stitch me up, and bandage it. So then I'll be in a big bandage for about a week and a half, almost 2 weeks. Then I go back to the doctor, take off the bandage, get rid of the stitches, and put on a waterproof cast, and that stays on for about 2.5 weeks. So from the date of the surgery till I get the cast off is about 4 weeks, about a month. So, and then I go into a custom-made removable splint, which will be great, because it turns out there are all kinds of things that you can't do very well or can't do at all with just one hand. So I imagine washing my hair and putting on makeup and getting dressed. I will be working from home for a while until I can properly dress myself. And that's what I've told them. And, you know, I haven't mentioned hair and makeup to them because they're probably like, oh, just come in, you know, put a baseball cap in your head. I don't know. So we'll see how that goes. Yesterday, I chopped up a bunch of onions and I measured half cupfuls. I put them into plastic wrap, each of them, and I wound the plastic wrap around and had all these bunches of chopped onions in plastic wrap, and I put them all in a freezer bag and popped it in the freezer. So now I'll have some chopped onion for a while. And I'm sure there are other things that I need to think about, but I'm cleaning and I'm taking care of things all over the house before this happens. because, you know, it's going to be interesting to just have the one hand. All right, so if by the time this goes live, my plan is to put a bunch of videos up live all at once, and I think by that date the cast will be off. So we'll see how this goes. There's another woman who documented her journey with this surgery and getting better on YouTube, and it turned out that she ended up being a worst case scenario. So most people just have the bad pain where they need the pain med for a couple days, a day or two, and then they're on regular Tylenol or something, and then they don't even need pain med. And this woman needed the pain med for like 2 weeks. And also she found out, and this might be part of the problem, that the anesthesiologist, when he put in the shot in her arm to numb the arm, he caused nerve damage. So I'll be having a conversation with the anesthesiologist before we start. Apparently I'm also going to talk with that doctor before the surgery about whether to put me completely under or if I'm going to be in twilight. My surgeon prefers the twilight, and he said as the numbing of the arm goes down, that's when I'll be more awake, and that's when I'll take the prescription pain med. Again, I hope I don't need it for very long. So I've already bought a thing that you put over your arm, the bandaged arm anyway, to keep it dry in the shower, or, you know, whenever I'm going to be around water. So that should be interesting. And yeah, I'm interested. The reason I'm making these is to help other people who might be having the surgery. So anyway, maybe I should put this video up earlier. I just looking for tips about what else to do and what to be prepared for and what to have in my house in order to be prepared to just have one good hand, and at least it's my dominant hand. I can still write. So this should be an interesting journey. Thanks for watching, and check out some of my other videos that are about this topic. I'm going to put them all in one playlist. Thanks for watching. Bye.